Morning, everyone. Bryce Besser, Chair of the Staff Association. Thank you so much for joining us. We're going to go ahead and get started in just a moment. We're letting people come in from the waiting room. Thanks for being patient while we get started. Well, good morning, everyone. I'm seeing that you're all coming in from the waiting room. Thank you again so much for joining us. My name is Bryce Besser, and I'm the chair-elect for the UC San Diego Staff Association. On behalf of the Staff Association and Human Resources, I'd like to welcome you back to Cabinet Conversations. Cabinet Conversations is a series of conversations with our cabinet members, and it's designed to provide staff the opportunity to get to know our campus leaders on a more personal level and hear what they have to say about important topics that are impacting our campus. It came out of your requests from Staff at Work survey, the Council for UC Staff Assemblies engagement survey, and the Idea Wave that was part of the Staff Association Executive Board's strategic plan a couple of years ago. Today's webinar features Patty Maysent, Chief Executive Officer for UC San Diego Health. Before we begin, I just have a few procedural items and then we'll get started with the program. So you all probably have noticed we're recording this and it will be up for viewing shortly after the end of the presentation. We've received a number of questions from staff before this, so thank you so much to those that have submitted questions. If you didn't submit questions, you can do so with the question and answer function. There are moderators that are monitoring the questions, and we'll try to get to as many of them as we can as time permits. Like I said, we did receive a number of questions beforehand, and so we'll be getting to a lot of those pre-submitted ones. So we might not have enough time to get to your questions today if you add them in, but please do. And what we can do is we can save those questions and pass them along to Patty's office. And that way she can take a look at them and address and answer questions that she can do that. So without further ado, I want to go ahead and welcome Patty Maysent. Thank you so much for joining us today.
Thank you for having me.
Yeah, it's our pleasure. I know that you're doing kind of the Zoom shuffle, so thanks for bouncing around and joining us today for our presentation. These have been a really wonderful webinar series for our staff members because it really just gives them a chance to see our executive leadership and ask questions. And really what I like to do is start off these webinars by just asking, how you're doing and what you've been up to. So to start off, how are you doing today? What's kind of on your calendar for the day?
Yeah, it's a super busy day, and it's been a super busy period of time. We have had a year and a half like no other imaginable. I've been in healthcare for 35 years, and the last 18 months have been unbelievable. We were counting the days. I think we're at like 475 days or so since the first planes arrived from Wuhan, and our lives got turned upside down, and we started trying to manage the pandemic. So the good news for today is, so we've made it through, I think, the worst of the worst. We've had this incredible role in the region over the last 18 months, and kind of culminating in our efforts to vaccinate the communities that we serve. And we've got some really exciting work going on right now, which I can't talk about, but it'll be released later today internationally across the border relative to some vaccination efforts we're doing that you'll hear about in the press. So that's what we're working on. We're also trying to manage through, on top of everything else, the Scripps Health had a ransomware attack that locked down their entire system, all of their systems, their medical record, their computers, their elevators, telemetry, everything got locked down about 4 weeks ago on May 1st. And so we've been managing this huge overflow of patients, transfer of cancer patients to us, our emergency department. We've got tents out taking care of patients because Scripps is still caring for patients, but they don't have access to their records. So a lot of patients are coming to our emergency room and coming to our clinic. So our teams are incredibly tired and yet serving a really, really important role in the region. So we're hanging in there. So that's what I'm doing today, Bryce.
Never a dull moment. It's amazing it's amazing to hear about kind of that collaboration for patient care between, different medical centers. And so for me, I think I didn't actually realize that that's something that might happen. I mean, and of course, when you have ransomware that takes you down, I mean, you got to make sure that your patients are cared for. So
Yeah.
thank you so much for, being there, and for the staff they're helping care for patients that weren't originally with us, but now making sure that they have care. That's awesome. So you have a short presentation that you'd like to run through with us. Why don't we start with that, and then we can get to some question and answers.
Yeah, I just wanted to provide a really brief overview of the health system. And so I'll do this really quickly just to give you a sense of what's included, what's in scope of the health system. So next slide. So when we think about health sciences, we have the three schools, the three professional schools: School of Medicine, School of Pharmacy, and School of Public Health, and the Vice Chancellor's Office. So that's on the academic enterprise. The clinical enterprise involves everything that's within the clinical environment, from all of the facilities we have, as well as all of the ambulatory centers in our clinical integration network, et cetera. So that's the clinical enterprise. That's what reports up to me. So that's the stack that I'm responsible for. Next slide. To give you just a sense of our mission and our vision, I'll just focus on our vision because I think it's really important. We are the only academic medical center in this region, and that actually means something. And for us, what that means is that with our very rich history of basic science and translational research, that we're working hard to bring cures to the bedside that we've created in our science labs. So this idea that we're creating a healthier world, one life at a time, through new science, through medicine and new cures, is really the heart of who we are. And we really differentiate ourselves in this region. I mean, Sharp and Scripps and Kaiser, they're great systems. They have their own niche, but we take care of the sickest of the sick. And, we have undoubtedly the strongest faculty taking care of cancer and cardiovascular and neuro and all the diseases for patients who get really, really sick. It's interesting because yesterday I got a note from a senior executive in one of the other health systems whose son is getting surgery here. And it's just interesting when push comes to shove and something really is bad happening to your family members, even they're choosing our unbelievable faculty to take care of them. So in terms of size, next real quick. So we have actually a little bit more. We almost have 10,000 employees on the health side. We have 808 beds. We are seeing over 1 million. It'll be over 1 million this year in terms of clinical visits, and our budget is $2.3 billion. Next. We work hard on quality, and we're really excited to see our progress. We're currently ranked right now in the academic medical center world across the nation. We're currently at number 7 in terms of clinical quality. And so we've worked hard to improve our clinical quality scores. We're now, number 1 in the region. It's the first time we've ever had 5 stars CMS. So this has been a huge focus for us, is to ensure that we're really providing the highest level clinical quality available in the region. Next. And we've spent a lot of time building out our network. And I put this up because I don't think people realize how much development we've done. I think there's a question, and I'll answer it now, about what have I tried to achieve the most in the years that I've been here. And it's really when we started here in 2012. The clinical enterprise at UCSD was really focused on tertiary and quaternary care, this really complicated cases. And the theme you would hear a lot is we only need a clinical enterprise big enough to teach our students. And with the passing of the ACA and the growth of the other systems, that just wasn't going to work, because all of those tertiary and quaternary patients were going to be steered away from us. And so we've spent a really night and day building out our network so that we can provide access to patients throughout the region. This is really important for our team members on the health side, but also on the campus side, that as you think about your health insurance choices, and if you want to be covered by UCSD Health, that we're creating access points for you throughout the region, so that you have. Our goal actually is to be within 15 minutes of anyone's home that they can access care. So you can see all the dots on the map that we've worked really hard to develop. So that's been a huge part of what we've been doing the last 5 years or so. And I think that's it. Maybe one more. Oh, and then another huge strategic effort is the redevelopment of our Hillcrest campus. So we started our clinical history taking over the county hospital. So there is no county hospital anymore. Our Hillcrest Hospital is the county hospital. We took it over in the late 60s. And it is it is an old facility. It's not seismically compliant. So we started this process of developing and visioning for the Hillcrest campus. If you know, and I'm sure some of you are from that area. I mean, it's a really exciting growth area in the region. The Hillcrest area is just really become a fantastic area to live and work and walk around. And so our thought in developing this long range plan is that we're going to take down really almost 38 or 40 buildings that sit on our Hillcrest campus and completely redesign it over the next 10 years, which is a $2 billion effort in partnership with the campus. So the picture gives you a sense of what we're looking at, the replacement of the hospital. But the very first thing we're going to do is build an outpatient pavilion, and we're going to put a big cancer footprint there. Because we don't have a comprehensive cancer footprint in Hillcrest. So we're gonna do that first. And I'll be taking that to the regions in a couple months. Okay, that's it. Those are my introductions. Sorry, keep going. You can take that down. All right, let's get to questions.
No, of course. No, thank you so much for the presentation. I think it is really important for our staff to learn about it, especially those that might be on the campus side. So they might not be fully up to speed or know a lot about the enterprise that's over there. And it's complex and it's big. And so what I loved about the presentation was the map that you showed with our presence throughout the region. Because, there's many different hospitals or health providers that are in this region. So for me, I think it's great to see that we have folks, that are close to our people. So thank you so much.
Yeah, we actually think a lot about campus employees and how to best serve campus employees. So I don't know if people have visibility to that, but just know that we think a lot about you and how to serve you better.
Yeah, that's great. And there's a question, if we have time to get to it a little bit later, a little bit kind of along the same lines. So hopefully we'll be able to fit that in. Okay. But one thing that I wanted to get to real quick was, again, this is an opportunity for us to get to know you a little bit better. And so one of the intro questions that I typically have is, do you have any hobbies or things when you're not working, which I can't imagine when you have time to not be working, but when you have some off time, what do you typically do to fill that time?
So people who know me know that I've been a lifelong swimmer. So I was a competitive swimmer, and I actually swam for Stanford. We won 2 national championships, and I was on the US team. We boycotted the 80 Olympics. That was kind of my year. But I've been swimming ever since. And so, if you ask me what I did this weekend, I swam on Saturday in the pool, and on Sunday I was in the ocean. And I also love to surf and be in the ocean. So I have a bucket list swim coming up this summer. I'm going to swim from the Golden Gate Bridge to the Bay Bridge in July. So I'm super excited about that.
Wow. What's the distance?
It's about 6 miles or so, but it's there's a current assist, so you've got some current pushing you a little bit. So you're not in the water, more than a couple hours.
Well, best of luck with that.
Yeah.
I don't know, draft up maybe a little blog to let everybody know how it went.
Yeah, I'm excited. I'm from the Bay Area, so this is a good one for me.
I had a chance to spend a lot of time in the Bay Area growing up. My father lived up there, and so we went to a lot of 49ers games and a number of different, and Oakland athletics as well. So spent a lot of time up there, and Golden Gate Bridge and the Bay Bridge are etched in my memory from all the time I spent up there.
I grew up in Oakland, and I grew up with the Raiders and the A's, but I just have to do a huge shout out to my Padres, who I'm in love with. They're just like the bright side of this pandemic, and I just love watching them. They've been such great partners to us, and we're kind of Tatis fans in our family.
Yeah, well, how can you not be?
How can you not be?
I was fortunate enough to be able to go with the family on Sunday, so we were able to see a really good game.
Yeah,
started out slow,
but you saw the Grand Slam.
Saw the Grand Slam. Yep, fireworks came out. Yeah. So, speaking of Grand Slams and things, try to transition a little bit to another question. And this one actually is something that I think is on the mind of a lot of folks, and that is, as we're kind of coming through the pandemic, do you see any changes in the healthcare landscape? Are there what types of things that we've learned from the pandemic? Is it going to be easier or harder to obtain healthcare? Anything that you have to offer on that?
Yeah, I think it's going to be easier. And the reason I say that is that we had this tremendous growth of telehealth, which has been really phenomenal. I think when it was clear that we needed to move to telehealth, I think the prior year we'd done like 30 visits of telehealth, and overnight in one weekend, the switch was flipped and we did 1,000 that next day in a day. So that horse is out of the barn, and I think it can be extremely effective. My parents are both 92. It's hard for them to go in a healthcare facility. They can get 80% of what they need on a televisit, and it's huge for them. So we're seeing at least 20-25%, maybe even 30 in some cases. For mental health, it's going to be even higher. Tele has turned out to be a wonderful way to access mental health services. So I would expect that will increase our ability to bring in more patients and to care for more patients. So that's a biggie for sure.
Yeah, I had an opportunity to do a couple telehealth visits, over the past few months, and actually did go in for a physical therapy appointment. Actually, I had to go in person, so that was kind of different, being able to actually go back in. One thing that's been on my mind, and it might be on others, is where are we at right now when it comes to family members and loved ones being able to visit folks that are in the hospitals?
Yeah, we've been able to, because of the fact that there's so much decline in the virus, we've been able to open up our visitor policy quite a bit. So I won't go through the specifics. It's dependent on the setting, if you're an inpatient or a surgery or an outpatient or ambulatory, but the visitor policy is lightened up quite a bit. And then after June 15th, we'll make it even more accessible after that. It's been really hard to not have family members in, because you need a family member with you to be your advocate in healthcare. You really do. And so I think the teams have done a really good job. If you think about our ICU staff on the telepad or on the iPad with family members on the outside trying to coordinate care, they've done a really good job, and they've used the technology to support it, but it's not the same as having your family member in the room advocating for you and hearing the conversation, et cetera.
Yeah, that makes me feel good just hearing it, because I know that it's been tough for folks that have had loved ones in hospitals. There were occasions where I had a family member that had to go in just for minor things. It didn't turn out to be serious, but yeah, I mean, those were kind of the more stressful times, and we were thinking, if this gets worse, right, how are we going to be able to kind of be there and help out? So that's good. I'm glad to hear that. Kind of switching topics now. So this past year, we've seen a lot of injustices to marginalized populations really come to the forefront of our minds. And so can you talk about the ways that UC San Diego Health is supporting our diverse staff populations, including, our Black staff and our Asian colleagues?
Yeah. And check me, Bryce, if I go on too long, because it fits into a number of buckets. So I don't want to over talk this, but so let me break it down. Let's start with health disparities. So we have faculty and staff that work a lot on the areas of health disparities and how to improve access and care to underserved populations. And so I'll give you a couple of examples that we've been able to do that have been really nation leading. We have a group led by Dr. Amy Siddipati, who actually she is an information guru, and she went into our electronic medical record, and we reestablished our records to be very transgender friendly. So you can come in, and all of the systems are supportive of gender identity and how you want to identify within gender identity. And then all of our staff was trained as well. So that was a huge effort. That's one example. Another, again, is around our vaccination strategy. So as I said today, we're doing some work across the border, but what we realized, even with the Petco effort, and we've almost vaccinated 500,000 people now, but the Petco effort we thought was going to be really accessible to everybody, including underserved or underreached communities. Turned out that wasn't the case. Like, everyone that had a computer who could sit around and wait to make a time for an appointment and could get in a car and wait, got the appointments. And what we found when we looked at the Healthy Place Index, which is the index we use to measure health disparities, is that those zip codes that were most in need were not getting access. So we set up what we call our mobile vaccine clinics, and we've been partnering with our community partners throughout the region. And it's out delivering vaccines as we speak. We're going to different community partners and providing education and providing vaccines. So that's that work. If I could, I'd show you a video. We just saw it yesterday of the vaccine bus working. It's just amazing. And so what's been really exciting for our teams, particularly our faculty and staff, like, we can disagree about stuff, but everyone agrees with, like, we want this pandemic over, and we want to be able to get to these communities that have been so disproportionately impacted. When you look at the health disparities in COVID, it is shocking. Like, it would make you sick to your stomach that, it's so disproportionately impacting our Hispanic community, our Black community as well, but even much more so our Hispanic community. And it's just, the disparity is huge. So that everybody's focused on it. We're trying to get to those markets and deliver vaccine and deliver care and education has been a huge lift for everybody. It's something we all feel really almost emotional about, because it's been so life affirming for us, actually. So that's that front. On the organizational side, so we have three different other groups working. We have a group working on healthcare policy, and this stemmed from a couple of incidences that happened right after the George Floyd murder. And what was happening is folks were coming into appointments and meeting residents, Black residents in particular, treating them really disrespectfully. And so we set off on, how do we set up a policy that protects our teams from, so we still have to provide healthcare, right? Our doors are open. We're going to provide, you can be as extreme a person as you're going to be. We're still going to provide you healthcare. But we have to set a limit on how you treat our people. And so that's kind of what that group has been working on. So they've been pulling through a policy to help address issues like that. On the recruitment retention side, our human resource group does a lot of work with the Black Nurses Association, Hispanic Nurses Association, Filipino Association. We look at ways to create a pipeline for people to be hired into our organization. Generally, we're relatively diverse. We could do better, but we're relatively diverse in terms of our staff. Where we fall short, that I'm trying to address right now, is at the executive level and at the faculty leadership level. So for instance, my executive team was very diverse from a gender perspective, not diverse at all from a racial perspective. So we're working really hard to address that. We're in the process of recruiting a new chief administrative officer of health, equity, diversity, and inclusion. In fact, I have my final interviews with the candidates today, fabulous candidates. But we're looking to diversify that, my team, because that carries through. And then on the school side, we just had this opportunity of recruiting 6 new chairs under Dean Garfin's leadership. And this was huge, because I have to tell you, I've been the only woman in so many meetings over the last 6 years, and not much racial diversity in these meetings as well at the chair level and beyond. And now we have a new chair of the Department of Medicine, huge area, woman. New chair of Department of Orthopedic Surgery, woman. New chair of OBGYN, woman, Black. I could go through the list, but just a lot of gender diversity and focus on racial diversity. So I think we're on our way. I think that sets the tone, but we have a lot, no excuse. We have a lot of work to do.
Yeah, and we all do. I mean, really, we all do. And just being able to be intentional, with our practices and having the various lenses, right? The race lens, the gender lens, right? Coming in and solving those issues with that framework in mind, I think is where we have to be. So thank you so much for sharing all of that. Sounds like you're making wonderful, wonderful progress. I wanted to share with staff that are joining us that there was a recent article that was highlighted, actually highlighted a group of nurses with UC San Diego Health that have been doing things for social justice. And so what you talked about earlier kind of dovetailed already into that, but I did want to mention that there is an article out there. I'll find a way to try to share it with the other staff members that are joining us, but the group that was planning this when we were doing our research found that article, and it's actually really, really wonderful. So there are nurses out there at UC San Diego Health that are joining the fight for social justice. And so I want to give them all kudos, and you as well and your leadership team for all the work that you're doing in that space. A couple of other questions about kind of cultivating from within. This comes from a staff member. So what strategies are being implemented to develop non-nursing but clinical leaders for promotional opportunities?
Yeah, that's a good question. So we have a couple of different efforts to develop our teams and give them runway to grow their careers. If they want to go administrative, there are some skills that you need. There is some background that you need, and our human resource group has professional development opportunities available and trainings available to train people. So that's one set of efforts. We also have executive coaches available for people when that's helpful. We're also do a lot of training across our organization on Lean Six Sigma skills and other project management skills, so that our teams, they're getting yellow belts and green belts. If they're interested, they can get a black belt, which is kind of a certification that helps you streamline and lean out an operation. So those are really helpful, I think, to staff. If you want to grow those, that's a really good path. And we've got our hope is to have, 10,000 people focused on making this health system as best as it can be. And so equipping everybody with those kind of skills has been a priority for us. And then we have some things like we have what we call the Health Leadership Academy, which is a program that we sponsor together with the school that we do it in partnership with the Navy, and we have about 45 faculty and staff who go through a process of admissions to get into Health Leadership Academy, and then they go through a year training, ending with a capstone project, and they get it's a Friday, Saturday program, and that's a really good, like, if you want to move into senior leadership, that's a really good program to get involved in.
Moving into maybe a little bit more specifics, from the general question to more specifics, do you have any advice for women that are working at UC San Diego Health and how they can advance their careers?
I would say, get involved. There's lots of places to, and then look for those opportunities to develop those skills, and, go get a green belt. It's not that hard. It doesn't take away too much. Go, kind of add to your arsenal of skills that you're bringing to your position. This might be a gender statement. Women tend to advocate less for themselves, and I would encourage them to speak up and, to get involved. And we have And maybe the other thing I would say is we have wonderful leaders. So hitch yourself on to someone to mentor you. So, when you think about, you can get mentored, right? And you can develop skills from your mentor, but it's even better if you have, we use this terminology, but if you have someone sponsor you. And what that means is you have someone that's putting you forward into positions of opportunity for growth, right? So in my career, I had a wonderful mentor and sponsor, and when opportunities would come up, even if I wasn't quite ready for it, he would sponsor me into that position, and then I'd grow into it and I'd develop those skills. So it's sometimes it's, you're really blessed if you can find someone who can kind of serve that sponsorship role and really get comfortable with your skills and push you forward when they see there's opportunities, so that you have that opportunity to grow.
Yeah, really good advice. I had an opportunity to participate in the virtual Risk Summit, which is a University of California Office of the President risk-based conference that they have every couple of years. And Cheryl Lloyd, who is overseeing the risk side of the University of California, is also pulling double duty over in the HR side. And she was talking about how she's two-job Cheryl, and when approached with the opportunity to fill in an interim role in HR, that it wasn't something that she was initially at all interested in. And it was one of those things that, over time she was, I think, talked into it a little bit, but the advice that she gave was to paraphrase it, right, was to stretch, right, to stretch yourself. I think that goes to all staff, right, is there are times when we don't want to necessarily do something because we might not have the skill set, or we don't think that we do, or we don't necessarily know a lot about this subject. And so we don't necessarily think that we're qualified, or maybe we're fearful that we'll mess it up or something. And the advice that I've heard from many leaders is to stretch. If those opportunities come along and present themselves, try to take them, right, and try them out. And even if there's some new position that maybe you don't feel like you're 100% qualified for, try to figure out, the transferable skills and really put your best foot forward. And you'll never know, because you have to start somewhere. And if you give yourself the benefit of the doubt, you probably know a lot more than you thought you did, and you can do a lot more than you thought you did. So
yeah, and even just along those lines, to when positions are posted, just go for them. It does two things for you, right? It helps you grow and kind of figure out what it would take to get that position, but it also lets leadership know that you're interested in growth. And so, I really encourage internal candidates for positions, even if it's a little bit above your head, just for that reason.
Yeah, great advice. I often say that too. There's folks that have come to me in informal mentoring settings and also mentoring settings through the university. And a lot of times I tell them the same thing: is if you have a chance to apply for something, apply for something. It gives you an excuse to refresh your resume. And if you get that interview, it's great practice. You learn a lot about yourself, a lot about the organization. Even if you don't necessarily get the job or job offer, you still learn a lot more about the organization and maybe what skills you have that you didn't necessarily think about. And if nothing else, you can kind of, especially if it's a good interview experience, sometimes, you can walk out of an interview and you might not get the job, but it was like, but I did a really good job on an interview. So it gives you a lot of confidence to do a lot of other things. Switching gears a little bit, going back kind of into, during the time of the pandemic, and this is just in general as well. My wife is a nurse. She's a director at a surgery center up in Poway. So I'm pretty familiar with, through her experiences, how intense the health profession can be. Can you share a little bit of information about how UC San Diego Health is addressing climate and culture for staff?
Yeah, it's a really good question. We actually, just this last week, we've released a pulse survey. So what we've kind of come to is that, we can do these really long surveys, but we want to try something like, let's get out like 2 questions and let's hear what people say, and then let's figure out how to be responsive and show, immediate impact on that. So we're thinking a lot about engagement and alignment and how to improve it. I think our alignment as a health system pre-pandemic in the staff area, it's pretty strong with room for improvement. On the faculty side, the engagement was not good. And the pandemic has really brought us all together in a way that I could never have imagined. This is one of the biggest silver linings that we've experienced, is that when we all focus together on one thing and we're all aligned on, treating patients, moving the region through the pandemic, providing vaccine, all the work that we've done, it's created an alignment across our system that I just don't want to lose. So, kind of as we come out of the pandemic, the question is how do we, improve the culture and keep it up? One area that's a little bit sensitive, but we do have to work on, and we are working on, is bad behavior in the system, and how do we deal with both physicians, surgeons, staff who who have behavior issues, and faculty in particular. This is really hard work, but it sets a tone. How much do you allow a surgeon to browbeat the front desk and to beat up the team? And it happens, right? It happens in any system. But how tolerant are we of that? And what does that mean for engagement? I mean, it makes, obviously the staff gets fearful. It creates this hostile work environment situation. So we're really sensitive to that, and to try to find ways to root that out of our organization, so that everybody feels safe coming to work. And and the surgeons benefit too, as an example, because then the teams are happy to work with them. If you're getting beat up, you don't want to go in that procedure suite or that OR or that clinic room with the someone that's beating you up. So those are things that I think we're concerned about. We spend time focused on.
Yeah, thank you. Kind of along the same lines, when it comes to our staff members and their overall well-being. So over the past year, a ton of attention has obviously been focused on our healthcare workers, nurses, and doctors during the pandemic. But I mean, the pandemic has impacted everyone, and it's, I'm sure, significantly impacted our staff who work in healthcare. Can you tell us a little bit about the experience that our staff members have had at UC San Diego Health during the pandemic?
Yeah, I mean, it's been really hard. I know we talk a lot about healthcare workers, healthcare heroes, across the country, but for our staff in the clinical environment, especially in the beginning, going into ICUs, not understanding the disease, imagine that you're pregnant, imagine that you have small kids at home. We provided a lot of support for our staff. The chancellor was wonderfully generous at working with some hotels to provide lodging. So if our staff was nervous about going home, they could, stop at a hotel for a night or two and shower. You hear the stories of our teams like coming home in the garage and taking everything off and washing down. And, long term that turned out to not be quite as necessary today as it was in the beginning, but we didn't know what we were dealing with. So it's been really challenging, and the mental health of our teams has been, I think, really challenged. And so we have paid a lot of attention to it, but we hear a lot too. I have the really good fortune of having a chancellor on this campus that embraces the health system. So I'm actually a member of the cabinet. That's not true at other UCs. The health system CEO is a member of the chancellor's cabinet. That's not true everywhere. In fact, I think this is the only place that's true for. And it's just because our chancellor really embraces us. So I hear a lot about also the mental health concerns and just the fear, the really deep fears people have about coming back to work. And so we're doing a lot of work with the students too. What are the mental health needs? How are we going to stand up more capabilities to provide support to our students, staff, and faculty? It's something we actually are spending a lot of time on.
Yeah, but I'm being mindful of time, and we're getting close to the end here. We haven't had a chance to get into a lot of the return to work discussion. So that might, have to be tabled for another time. But I mean,
Sure.
certainly, I know that you all at UC San Diego Health are talking about that, and that many of you all have been on site since day one. So yeah, from my perspective, again, be mindful of time. I want to make sure I'm able to ask maybe one or two more questions here. But I did want to just weigh in, and there are a lot of different for staff members that are tuning in. There are a lot of different resources that are out there, both on the campus side and UC San Diego Health side. So please just reach out to your supervisor. Check out Blink or check out UC San Diego Health's websites, because the resources are there, and use them. They're there for our benefit, right? Sometimes we think that we have too much to do and we can't take a break, and you keep running like that, and your body and your mind are just going to tell you it's time to take a break. They're just going to shut down. So we all have to do our best to take care of ourselves. And so thank you, Patty, for creating a space, for staff members to have care and to be allowed to care for themselves. I think it's great. One more question that I'd like to ask, and then we'll see if we can sneak one more in, but this actually came from another staff member just before the webinar started. And I think it's a good one, because many of us think of UC San Diego Health and the campus separately, right? I mean, we've been taught that we're all one UC, but a lot of times we still think of ourselves as different. And so the question is, what are some ways that UC San Diego, the campus, can better support UC San Diego Health employees? How can we kind of start meshing in? And this is something that's important to me on the staff association, because we're always trying to remind people on the health side and Scripps that you're all part of the staff association, right? We're all one staff. And so what are your thoughts on that?
Yeah, we really are one campus, and as I said, we're integrated here in a way that doesn't happen other places. So I think our human resource teams work closely together, and that's really helpful. I don't have a great answer to that question, Bryce. To be honest, I'd be interested to hear your all thoughts about how you think you can support our team members. I think that'd be a really good dialogue to have.
Yeah, absolutely. I mean, and again, we're running low on time, but certainly happy to talk about it further. But I mean, from my perspective, it's, at least on the staff association side, we are always mindful of reminding staff, whether you're at Scripps, whether you're at UC San Diego Health, whether you're at Skaggs School of Pharmacy, or the other little branches of within UC San Diego, that we're all UC San Diego staff. And so, there are, the community is here. And so while there might be different neighborhoods and different, feels to things, that when it all comes down to it, we are together. So really, it's mindful. We're just being mindful of ways that we can reach out and connect with those campus partners and those groups, to make sure that they're aware of different events and things that are going on. Opening up the cabinet conversations, for example, and making sure that we have representation from everywhere, so that UC San Diego Health feels involved and that they can hear about the wonderful things that they're doing, right, and get kudos. I mean, those are all things that are kind of on top of mind for the staff association. So,
Great.
One last question, and then we'll wrap it up. And this one's kind of a softball, but I'll do it anyway. So 2021 is here. Is there one thing that you're most excited for?
It is a softball. So we're really excited to get past this thing. We're really, on the one hand, we're just excited to get through this pandemic. It'll be great to have our campus kind of return to some new normal, for sure. And then really, we're back focusing on all those things that got put on hold for 18 months while we managed through this. So we've got a lot of exciting development to do. The Hillcrest development is going to be huge. Going to need a lot of support from the state and the county and others to make that happen. We're working on a joint venture right now with the county to build a new inpatient mental health hospital on 3rd Avenue. So really excited about that development. I think that'll be a game changer. Working really hard in this mental health space, making sure that we destigmatize it, and we provide the kinds of resources that are needed in the region. We're very underserved in mental health services right now.
Yeah, no, thank you. so much. And I too am looking forward to the day that, I'll be able to come together with my colleagues in person, and we'll be able to kind of celebrate those times and be able to just build off of, the collective experience that we've had with the pandemic. Many of us have been impacted in different ways than each other, but at the same time, at the heart of it, we've all gone through it together. So Patty, thank you so much for joining us today. I really do appreciate your time. I know you're a especially busy person, so really, again, thank you for answering our questions. That is all the time we have today, but I wanted to remind everyone that we've saved questions that have come through. We'll pass them along to Patty's office so that she's aware of those questions and so that they can look at them and respond to them if they get a chance to. I want to thank everyone for sticking with us in Cabinet Conversations today, and remind you all to join us on June 15th for our next Cabinet Conversations, where we'll be speaking with Vince Kellen, our Chief Information Officer. You can view prior Cabinet Conversations on the Staff Association's website. That's staffassociation.ucsd.edu. Until next time, thank you so much, UC San Diego staff, for the amazing work that you're doing and for supporting each other, and be well. Bye-bye.